This mother of a 5-month-old girl baby who felt some painless swelling in the baby's head recently. CT skull was done. Please give the findings, and you have to give 10 differential diagnoses and then the final diagnosis. You can go through the actual images in bone windows and brain windows, and then you can go to the sagittal reconstruction, coronal and sagittal. Think about the findings, 10 differential diagnoses and the final diagnosis. If you want more time, please pause the video. You can go back to see the images again. Are you ready? Let's go. There is a well-defined non-enhancing soft tissue lesion with the soft tissue density being less than the CSF density. You can see the images. It is scalloping of the underlying skull with bony sclerosis. Again, you can see the bone windows. It's also contacting the superior sagittal sinus. Again, you can see on contrast image, and you can think that the epicenter of the mass is in the scalp. And I told you we have to think about the 10 differential diagnoses. This is midline cyst. So the first and most important one is dermoid or epidermoid cyst. Second one is it can be meningocele or meningoencephalocele or encephalocele. Third one, dermal sinus. Fourth one, leptomeningeal cyst, which is usually both post-birth trauma. Cephalohematoma or subgaleal hemorrhage, also again usually after post-birth trauma. Eosinophilic granuloma is also another differential, which does not have a beveled sclerotic bone. Then is this epidermal scalp cyst, where should not be any skull defect. And seventh one is sinus pericrania. It's a very soft fluctuant mass which is changing its size during maneuvers. And eighth one, histiocytosis or neuroblastoma. And rare and unlikely causes are lipoma, arachnoid cyst, sebaceous cyst and hemangioma, which is very less common in infants, right? So that's the differential diagnosis. I told 9 differential diagnoses. The 9th one has got so many, 4 or 5 DDs. So the final diagnosis is midline dermoid cyst. Dermoid cysts are found in several locations in the scalp. They are thought to arise from inclusion of ectodermal elements at sites of sutural and neural tube closure. Dermoid cysts contain ectoderm and skin elements, whereas epidermoid cysts contain ectoderm but no skin elements. Very important. Dermoid and epidermoid cysts are most commonly seen in midline and in frontotemporal locations, followed by parietal locations. Common midline sites in the scalp are near the anterior fontanelle, glabella, nasion, vertex and subocciput. And some sutural sites like frontozygomatics, sphenofrontals, squamosal, coronal, lambdoid and parietomastoid sutures are also documented, right? This was given as quiz. Many of the contestants are superstars, so you can go through the 9 superstars and 2 shining stars who gave only the diagnosis, not the differential diagnosis. All right, so thank you very much. Bye bye.